we saw the incidences yesterday, over 2 million ACL tears in a year, about 80 per 100,000 citizens. That's what we just revisiting and reviewing what we learned yesterday. Greatest prevalence is in the young females, 14 to 18 years of age. 3% of amateur athletes injure their ACLs, but as has 15% of the elite. Non-contact injuries, 3 to 5 times more common in female athletes. This rate decreases as female athletes mature, but still disproportionate at the professional level. So as we go ahead, I mean, it says females are 2 to 8 more times likely to injure their ACL compared to the males in a study done by Hillibrand in 2015. 33% greater risk of contralateral ACL injury than males, the females have. High school and college female athletes up to 2.5 times more likely to sustain ACL injury than age-matched males. High school females playing soccer and basketball are 3 to 5 times greater than males to injure the ACL. So female athlete is at a very great risk of an injury for the ACL in between that age of 14 to 18, which is the high school age. Peak incidence, as we saw, Sanders et al. In 2016 said it is 14 to 18 years or in the early 40s, as per another study by Nitwis et al. In 2017. As against, if we see the ACL peak incidence rate in males is at 19 to 25 years. So comparatively, the wider range is for the females than the males. The males basically, the studies have shown that the peak incidence is basically in 19 to 25 years. Why are females more likely to injure the ACL? There are a few non-modifiable factors and modifiable factors which are causing them to land up with the ACL. So these are the non-modifiable factors are like the family history, it's the menstrual phase, generalized menstrual issues, generalized joint laxity. These are the few non-modifiable factors happening of genu recurvatum because of the intercondylar notch. These are the biological, anatomical biological factors. If I talk about the larger Q angles the females have, smaller intercondylar notch they have, smaller ACL size, larger tibial slope, menstrual in the pre-ovulatory phase of days 6 to 13, it's more growth spurt during the adolescence. These are all the anatomical and biological factors. There are other factors like the family history and past injury of ACL, which are also because of which the females are at a greater risk to injure their ACLs. Okay, so that's what I just wanted to throw light on that because I spoke about it yesterday and wanted to just go back to the same. And now we go ahead with the if anybody has any questions from yesterday, please, you can put it up on the chat box or the question and answer section. Okay, great. So I'm going to go ahead with this. So in the late post-operative phase or the return to sports phase, as we call it, it is the advanced phase of the ACL rehabilitation, ACLR rehabilitation. You continue with the closed chain kinetic work and you try and increase the loads on the closed chain kinetic works. So to make it more functional, like the loaded squats, loaded lunges, deadlifts, various things which basically would prepare you for the sports. Continue gym emphasis on strength, power, and burst strength is what you have to look at. Continue the stretches, like as often as you get PF symptoms, so stretching of the quadricep muscle, the hamstring muscle, the different muscles which are around the knee should be important to be stretched. Add agility at a certain stage, running drills, other agility drills such as jumping, landing, sports specific, cuts and turns, ball dribbling. If you're it was basically a sports specific, ball dribbling means any sports specific skill which you want to start. uh, uh, especially if it is we see a lot of injuries happening in soccer and Australian rules football or American rules football. So we basically start with some ball dribbling, the plyometric drills, and the reaction time drills. These are the various kind of drills which exercises which you should start in a late ACL rehab. So as you see here, it's an example of various, when you start with an ACL rehab. So of course, when you are better with the straight line running and there is no pain, no swelling, you have to look into the overload and the swelling. Then you start with some diagonal running. After that, you follow it up with some bounding. As you see, this athlete is doing it. You do to start some scissor running. Basically, we are preparing for a better return to sport. High knee running, as you can see, ensuring these are the various types of drills. Of course, this is just an example. You, of course, can modify it from an individual to individual, from an athlete to athlete. Single leg hops. So you progress to initially you start with the double legs, as we've seen, then the straight line single leg, and diagonal hopping of the single leg. Make it as sport specific as possible for all these kind of drills. Simple walking lunges. And definitely a lot of stretching would be required as you go ahead, ensuring because an athlete would be doing a lot of this kind of running work after a lot of gap. So ensuring the conditioning of the muscle is proper, you do proper stretches at the end of the program also, and before the program, to prepare it to undergo that kind of stresses. The muscles undergo that kind of stresses, and the joint takes over the similar loads as we're looking at. Similarly, more agility work would be, so that was basically to start the running, more agility work by using these kind of obstacles. This will help your cutting and changing directions also. You can use the sled pushes to generate power. Accelerating and stopping, stop and go, various kind of things. I mean, it has to be very much, as I said again, I'm repeating again, it has to be very individualized. And according to the sport, you see that lying, turning, turn and go. So that's a very agility work. So these kind of various drills need to be introduced for the agility work. Lateral proprioception and strength. You have examples of using the slide board. Very effective to gain the lateral strength and proprioception. Then skier jumps, the skier jumps. From the slide board, you progress to the skier jumps, which will be more sport specific. Again, it will give you the mediolateral stability. It will enhance it further and further. Single leg 90 degrees turns on single legs. 180 degrees turns. These are the various examples of how do you progress on proprioception and strength, lateral strength. And going ahead, plyo and power work with high jumps. You see the attachment of the power band behind, box step forwards, so it will increase. Okay, power band side to side box steps, so it will give you the lateral strength again. It is resisting. It is basically we are trying to kind of simulate these sporting scenarios, because the lateral resistance is something where you again get in contact with a player, because usually as we see, football or soccer is a contact sport. So this is how you progress on a plyo and a power work. You hop 180 degrees turn, trying to get the control. Definitely the box jumps. Of course, it's not in that order. You definitely, as it is shown in the video, you usually would progress from initially, as I said, landing is the first thing which you should learn. So from the landing, you go over to the box jumps. From the box jumps, you go over to the first is the landing. I mean, getting from the box, jumping down and landing, that kind of a thing is what is usually started in the plyo work when you start the plyometrics. And then you go ahead and do the hops, basically double-legged hops, the single-legged hops, then the box jumps to generate more power. The height of the box can go on increasing slow and steadily. So this is the usual progression for a return to sport, so that we make the athlete so robust that possibility of re-injury is very minimal. Of course, as we have seen, the re-injury rates are pretty high. This is basically a resource which I would like to share with you. You can use these resources from the kneeresource.com. It's available at the kneeresource.com. It's a beautiful way for the rehab phases. So it has given you the goals like control. The rehab phase 1 is control pain and effusion, terminal extension as soon as possible, preserve patellofemoral mobility, aim for 130 degrees of flexion. So these are the goals. The goals are listed there, and the criteria for progressing to the phase 2 is also listed there. So you can actually checkbox what you have done, and it's very handy for you as well as your patients to use these kind of a resource, which will help you progress through the various phases of ACL rehab. So that's the first phase. We have already spoken about the first phase, second phase, and we have already reached at the last return to sports phase. But these are the best thing. I mean, criteria for progression, you should see that the wound should be closed, no pain in phase 1 exercises. All these exercises which you're doing, there should not be any pain. There should be minimal synovitis and effusion, normal patellofemoral mobility, tibiofemoral range of motion at 0 to 120 degrees, voluntary quadriceps contractions, normal gait, and correct movement patterns with exercises. Similarly, phase 2, you can see it's very self-explanatory. I don't need to read through it. If you guys can just get it from the kneeresource.com, and you can be individually done with it can be customized by putting your own logos there, and you can use this resource for the ACL rehabs. So criteria for progressing to phase 3 is correct qualitative performance of the phase 2 exercises, limb symmetry index, LSI more than 80% for quads and hamstring strength, LSI of 80% for hop battery tests. Patient's questionnaires will be automatically emailed to the patient once you do that. And phase 3 is return to sport or physically demanding work. Here, again, the criteria for returning to play, no knee pain with, this is very important. This is the phase we were talking about today. Today. No knee pain with sports-specific activities, no giving away or fear of giving away during sports-specific activities. Very important to understand that. Active dynamic gait pattern and symmetrical jogging pattern, correct quality of performance with all sports-specific activities, limb symmetry index more than 90% for the quads and ham strength. Hop battery test should be more than 90% to the normal side. Drop test with analysis of movement, trunk, knee valgus, knee flexion when landing. Use ACL written RSI to measure patient's psychological readiness, confidence, and return to sports. So that is the questionnaire what you use. Minimal 6 months since the surgery, that's what they say. But I would say the latest reports, more than 9 months post-op, ensuring patient has completed return to sport criteria significantly reduces the knee injury rate. So you have to ensure that it is somewhere in between 9 to 12 months. When you have passed all these criteria, then you should allow him to participate in the competition to avoid any further injuries. I'm just going to put a word on the load management here. Um, it is important. So when you're progressing through the phases, basically the return to sport phase, or the advanced rehab and the return to sports phase, you have to check for effusion after every session or every treatment. Use the traffic light to monitor the loads. So monitoring pain and load response. So if the pain is in 0 to 3, it's a safe zone. It is 4, 5, it is acceptable, but 6 to 10, it is excessive. So ensure that you should take a feedback from the patient about his pain, and definitely you have to look for the effusion. Pain and effusion should settle within 48 hours after the exercise routine. Very important to say, if the exercise routine, the loading exercises routine has started and they feel some pain and effusion, and if it doesn't settle within the 48 hours, you have to ensure that there is something wrong with what you have done, or he is being overloaded. And so you would have to review what exactly has gone wrong, probably discuss it with the surgeon, and then go ahead. You have to be suspicious when there is effusion. Where that's what I said. If there is no relief after 48 hours, you're progressing too fast. So you got to take a step back and accordingly progress further. So load management is a very important thing when you're talking about returning to sport from an ACL injury. Yeah, so consequences of it, just more about the efficient normal healing reaction of a capsule. It is including post-op scope goes through the capsule. That's why usually a normal healing reaction to the immediate post-operative phase, there will be efficient, so that's okay. If more than 2+, don't load the joint. Listen to the knee. Increase in effusion says we are doing too much. Check before every treatment and rehabilitation session. So effusion is the key factor to look after whenever you are loading up the joint for a return to sport, in the advanced phases and the return to sports phases. This is the latest guidelines which I have come across for the return to sport. So definitely surgeon approval is the most important thing, because we are working as a team. We are working as a team towards this ACL injured athlete. So surgeon knows the best, and we should definitely at every stage and phase, we should report back to the surgeon, take his approval, and accordingly move ahead in every phase. MRI, for the based graft maturity, I'm not very sure if it has a strong evidence to get an MRI done to check the maturity of the graft, and if it's going to give you it will give you, of course, that the ACL is present. It won't give you an image of ACL deficient knee for sure, but it's debatable to check if the maturity of the graft is best for the progression. So possibly just to see there is nothing wrong, and if you see that if the swelling is too much, does not settling in probably 48 hours, then possibly you would see if there are signs and symptoms which lead you to take a repeat MRI to check the ligament there. Basic measurements, personality type is again one more thing to check. It's a very psychological assessment also when we are checking. I mean, what kind of a personality does the athlete possess? If he wants to do too much too soon, or he's too very scared to go about. So we have to really talk to them. It's very important for us as physios to deal with these guys, their personalities also, and accordingly progress on their rehabilitation. So you have to understand what level of sports activity they are at. He's an amateur, he's a professional. If he's a professional, then accordingly all those professional help should be taken from the various team members of the multidisciplinary team to move ahead in their sports. Patient reported outcome measures are the best ones which will give us a guideline for a safer return to sport. So I encourage all of you all to go through these various outcome measures which are present in the literature today, like the KOO score, the Tegner activity scale, the international knee deformity, IKDC, Lysom scale, Tampa, I mean, the various, these are so many of them. I'm not going to go through each one of them, but what we usually use at our practice is the Q score. Very efficiently, we are using that. We are using the Tegner activity scale also, and the Lysholm scale, which gives us the idea about how do we progress for their return to sport, or how do we progress through their phases. We actually have a protocol in our place where we do the Q score at 3 months, 6 months, and 9 months. Whenever we are doing, we also have a criteria. We also have a criteria of doing the isokinetic muscle testing of the knee of an ACL of an ACLR knee, ACL reconstructed knee at 3 months, 6 months, and 9 months. So we get a fair idea from how they are progressing on their rehab. So it makes us easier to get them back to the to build up through the phases and return them to the sport. The adequate ROM has to be present, which is the full ROM has to be present. Stable KT 2000, KT 1000 and 2000 measurements, which are not very easily possible in our setup here, but they are basically, if you can get those measurements, it will be easier. Balance testing, joint position sense testing, these are the other ones. Quality of movement test, stable manual ligament stability, Lachman and pivot shift could be performed. Manual muscle testing, handheld dynamometer, entire lower extremity. Isotonic strength tests were isokinetic strength tests. So in the isokinetic strength test, we do look into the maximum force and peak torque, angle specific torque, rate of force development, kinematic analysis, the gait analysis, functional tests. You do the jump test, the hop test for the return to sports criteria, lower extremity functional test, sports specific testing, and then we get them onto the prevention programs also. So that's the criteria, how basically is the latest way to decide the return to sport. These are the guidelines and criteria. ACL injury prevention, that's the best. I mean, prevention programs, they are talking about prevention programs a lot these days, and it is being looked into a lot. Best injury treatment is prevention, and contemporary efforts regarding ACL injury have embraced this concept. Neuromuscular control is thought to play an important role in the injury risk and has been identified as the most modifiable risk factor. So starting early on the neuromuscular control in the rehab phase also is very important. Similarly, we have seen, yesterday I showed you, when we were talking about the neuromuscular training, I showed you the example of the soccer training, how the soccer team was practicing and how they are using various props to balance them to the various imbalance or unstable props like the Bosu ball, the trampolines, the balance pads, the super bands to use the resistance in a specific direction. And that kind of stuff is very useful to be used, and that can be used as a prevention program in their daily routine. And that's what usually they do. It's not about only only in the rehab phase, but as a general routine, they are using these kind of equipments to better the neuromuscular control, which has been identified as the most modifiable risk factor. Increased dynamic valgus position and abduction loads in the lower extremity have been associated with increased risk of ACL injury in the female athletes. We have seen that. Why is the female athlete more at the risk? We have seen the various factors like the Q angle, the increased Q angle there because of their hormonal changes during the menstrual period. These are the various things which you have to look when you're talking about the females also. Driven by core muscular dysfunction, neuromuscular dysfunction, as well as lower limb asymmetry, defined as side-to-side differences in muscle strength, flexibility, and recruitment. So the ACL injury prevention program should be based on that. Um, as we go ahead, the neuromuscular training facilitates adaptation, which improve pre and mid-stance neuromuscular activation patterns, which decrease the joint motion and protect the ACL from high impulse loads sustained during performance. Emphasis on posterior chain muscle group strengthening, such as gluteus maximus, medius, minimus, and hamstring, reduces the load to the ACL. You have to work on those posterior chain muscle groups for the to reduce the load on the ACL. As we have seen, the difference in ratio, difference in strength, imbalance in strength in between the anterior muscle, which is basically the biggest muscle, quadriceps, as compared to the hamstring, are the people who have an imbalance there are more vulnerable for an ACL injury. Multiple studies conclude that Kinect system is feasible for dynamic valgus screening, drop vertical jump. So they basically had a test in this study where they used the Kinect system and they did the dynamic valgus screening of the drop vertical jump to identify individuals at a risk of ACL injury, as well as the targeted intervention. So possibly that is the way forward. If you can use this Kinect system to screen their drop vertical jumps and see how much of a valgus angle is dynamic valgus is being created at the knee, and if we can modify that and possibly intervene it, give a targeted intervention, possibly it would help to reduce the injury risk for an ACL. The latest evidence which is still being targeted is the real-time biofeedback integrated into neuromuscular training reduces high risk knee biomechanics and increases functional brain connectivity. A preliminary longitudinal investigation was done in a psychophysiological study and in one of the journals of that psychophysiology. And it is still not out, but I just come across this, but I found it interesting. So I thought I should share it. Possibly this is the way ahead, a real-time biofeedback integrated into neuromuscular training. 6 key aspects which are often neglected after ACLR, which may impact the neglected after ACLR, which may impact the player outcomes. Deficits in explosive neuromuscular performance, deficits in sport-specific movement quality, inability to tolerate fatigue, a lack of sport-specific training, on-field rehabilitation prior to return to play, insufficient intensity and volume of training prior to the return to play, a lack of focus on restoring the player's sport-specific fitness profile. So this was in the latest study in 2019, where they said these were the common mistakes that people did, and it impacted on the outcome of them returning to sport, and possibly either the return to sport was delayed or there were re-injuries. So from that, they get out this they have outlined this 6 key aspects. Deficits in explosive neuromuscular performance were found out in people who didn't return well back from their ACLRs. Sport-specific movement quality was of a down quality. It was not a great quality. Inability to tolerate fatigue, a lack of sport-specific training prior to the return to play. So that was the biggest thing. If you don't do the on-field rehabilitation in people, it is definitely possible that they will, when they participate on-field into the competition, they might not be ready for it completely. In these kind of times where we are seeing so many people, physio attendance for the ACL rehab. Physiotherapist-led rehabilitation is a key ingredient to the positive long-term outcomes of following an ACLR. How much face-to-face rehabilitation is required to achieve a satisfactory outcome? This was also studied that was also done in a study. The pilot study showed that patients who minimally attended physiotherapy in the first 6 months following anti-cruciate ligament reconstruction achieved similar outcomes at 12 months post-op as those who attended regularly. So it's a debatable thing, but yes, I mean, this research is very well valid in the present scenario of COVID, where people are not willing to come out of their houses for the rehabilitation. So our because of the current scenario, my advice would be empower them to take ownership of their ACL rehabs. Give them a great exercise advice, give them a plan, give them ideas how to progress on their exercises or regress them if needed. So how would you regress them? If there is a swelling in the knee, what they find, if there is a pain, you ensure that they have to take a step back and not go on loading the same knee, which is going to cause issues later on. Give them reassurance that if they are getting sore. Give them the confidence to do things without you holding their hand. So basically, I mean, you have to make them responsible. Today's patients, because of the current scenario, it is difficult to meet them in person to person. It is always nice to educate them, give them that kind of a confidence and the reassurance that it will be fine and they are going to get better and better if they also follow these kind of rehabs. You can use the online sessions, the telecommunication sessions, the video communication sessions. These are the best ways to move ahead in this kind of a current scenario. So I just wanted to put that across, that not necessarily, the studies have also shown that not necessarily every ACL rehab patient has to be in person with you. If he's in person, of course it is nice, but in the study it has shown that there is not much of a difference. So, but how you talk to them, how you give them the confidence, how you plan their activities is the most important factor in a rehabilitation. Okay, so we were talking about the prevention. Instead of looking to, we're looking at screening people at risk for an ACL injury. But instead of looking to screen those who are at risk of an ACL injury, we should be giving everyone an ACL injury prevention program vaccine sort of thing. So this was the statement which I took from Mike Hughes, who is an ACL expert himself in Melbourne. And he thinks that ACL injury prevention program is a vaccine, and it is not only an injury prevention program, but all the prevention programs are performance enhancement programs also. Why do you say that? Because if you're preventing an injury from happening, you are not regressing in your performance for sure, because your performance is just going to go ahead and it is going to improve. And that's why it is important to consider all the prevention programs what we have as a vaccine and as a performance enhancement program. Why are ACL injuries a problem? Nearly 4 times more likely to show signs of moderate to severe OA changes around 10 years post ACL injury. This was seen in a study in 2014. 7 times more likely to have a TKR later in life, those that had ACL compared to no previous ACL injury. Also significantly younger at a time of TKR with previous ACL injury, means 55 years versus mean 70 years without previous ACL injury. So yes, it is a problem. I mean, later in life, ACL injuries, that's why we need to try and prevent these injuries. And the best way is to provide them the vaccine, which is the prevention program itself. So rather than having them injured and rehabbing them, it's better to propagate these prevention programs. So if you see, there are so many issues later in life because of the ACL injuries. So it is better to provide them with this kind of thing. Why is this a problem? So as you see, there are this again very shows decreased QOL angle, QOL more than 5 years after ACL injury, regardless of intervention. Lifetime burden of ACL injury in USA, depending on the treatment strategy, ranges between 7.6 billion to 17.7. So there's a high cost also involved in an ACL reconstructed or an ACL injury people. So talent drain happens. Minimum 9 months out of sport, higher risk of second injuries, decreased performance measures for at least 2 years upon the return to sport. So when an athlete returns to sport, it definitely is not at the best. And minimum there is a huge gap. Even as I said, there is a gap of 9 to 12 months. 9 to 12 months. And there is a higher risk of second injuries because as we have seen, the injuries, re-injuries are more common than the primary ACL injuries. Decreased performance measures for at least 2 years upon returning to sports. So performance measures are also not great, as you see, because depending upon how you have rehab, and definitely the athlete is fearful. He has some apprehensions because already he has had one of the ACL being injured. So definitely there's going to be a psychological aspect to it also. So, I mean, there is, I'm just going to go through, I'm going to discuss and take questions as it comes. There are a few questions. So that's that about from me regarding the prevention program and the return to sport. But yes, I'm going to just share with you what kind of a prevention program is a good program for them to start with. So I don't have a slide for it. I'm going to stop the share and I'm just going to discuss with you what do I think would be a good prevention program. Just a second. Okay, there are various injury prevention programs which are present in the literature right now. People, you would have heard about the FIFA 11 plus. There is this program which you could be adapting during for all of them, for your team, for your athletes. There is a netball prevention program which is there in the market. Then there is, of course, there's an AFL, the Australian Football League. Prep to play prevention program. These are the three prevention programs what I'm talking about. These programs can be adapted. They are out with FIFA 11 plus. If you just Google FIFA 11 plus, you will get to actually let me get you that a good chart of FIFA 11 plus, which they have been using throughout the world for the ACL injury prevention. So it is a downloadable program. So it comes in a poster. Let me just get that. It comes in a PDF sheet also. There. Let me just share the screen again. If you see, it comes in a PDF format. It's about the whole thing. So this is a very good booklet. And there are various exercises given which could be used for the prevention. Like there are Nordic hamstrings, there are planks, there are side planks, different ways. This is basically for the soccer players, the football players. If you can see those. It even has jumps over a line. Zigzag shuffles. So this is a very good prevention program that could be used by anybody. And this can be downloaded from this site. So if you see, I've just gone onto that site, and if I just download it, it will be easier to save it. So similarly, you can do the same thing. It's very nice to introduce them to team sport as well as individual sport.
I think you can share the download link also in the chat box. If,
Actually, I should do that now.
yeah.
There it is. I've shared the download. There are other prevention programs also. There is a netball. I'll share that link of that also right now. Right now, I'm not able to just get that out. But these are the various programs which you can go through, and they're available on the internet. So it is one of them. I've shared it with you already. But yes, it would be very necessary. According to me, a simple prevention program, what you should follow is doing various exercises like the lunges, walking lunges, inclined calf raises, Nordics. You do this, then you do various jumping things, jump stick landing, drop jumps, drop jump. Maybe what I can do is what I have designed. I can just put it onto the chat box if you guys want to look through those things. This is a normal example from my side, but it can be modified. These are the various. I would basically do 2 sets of 15 reps of lunges, walking lunges, inclined calf raises. Nordics, 2 sets into 4 to 6 times once a week. Off season in season once a week. Off season you do it twice a week. You do the various jumps like the jump stick landing, drop jumps, drop jump, single leg landing, single leg drop hop stick, broad jumps, double leg jumps, plyos. These are the various things I would include in a prevention program for an ACL for any athlete who is vulnerable and who participate in a sport where the ACL is at a greater risk. Or in fact, in any sport, any team sport or any contact sport, this can be definitely be introduced as a prevention program. Yes, guys, are there any questions?
So yeah, there are a few in the chat box.
Chat box, where is the chat box? This is the chat box was open.
Yeah.
Please share the PDF for further reference. What PDF is he asking?
Yeah, they're asking for your PPT and PDF, so you can skip that. And BL Girish wants to ask something.
FIFA 11 is thought to be a warm-up program which consists of all components. Can we use it as ACL? Yes, it can be used as an ACL. It is an ACL. It is a prevention program. So you definitely, because there are jumps, there are various landing activities or jumping activities in that particular program. So it definitely can be used as an ACL prevention. It's a very good program which covers the whole body. So it definitely needs to be used. Can FIFA 11 be used to other sports than football? Yes, absolutely. You have to modify it accordingly. Possibly you'll have to change a few things to that particular sport. So possibly, if you're talking about cricket, we need to introduce. I mean, if he's a batsman, definitely he would like to run in between the wickets. So probably instead of the jumping, which he may not be jumping so much while batting, but he will be definitely turning, and quick turns will be happening. 180 degrees turns, 90 degrees turns would be happening. So probably you can modify that accordingly for cricket. I'm just giving you an example. But yes, if you see the FIFA 11 Plus and go through the program, it can be used for every sport. Santa Monica ACL prevention program will be useful. I have not seen the Santa Monica ACL prevention program, BL Girish. I'm not very sure about what you're talking about because I have not come across that. I know about the FIFA 11 Plus. I know about the netball and the AFL program.
So any further questions from the house?
There's somebody had raised a hand.
Yeah.
Neha Saini. You can unmute and ask your question, Neha.
Neha, do you want to ask anything or? I think Neha.
No problem. Is there any other questions, guys?
So guys, you can just ask anything to Vaibhav and
let us make it more interactive in the final phase, because from yesterday or today, whatever questions. Good enough, I guess.
Yeah, I think Vaibhav, they understood everything very nicely. So they don't have any question from their side. So guys, this is the end of this sports injury webinar, and we have completed all the 4 days, and we have discussed about each and every aspect of a sports injury related to knee, ACL, PCL, meniscus, overuse injuries, rehabilitation, return to sports, prevention. So we try to cover everything, and we try to propagate the knowledge regarding the practical knowledge, which was truly a practical knowledge, which can be useful for you all in your practice. So stay in touch, happy learning, and we will continue with the same educational webinar series to different joints, to different sports injury problem, sports medicine issues we would be covering, sports nutrition, anti-doping, sports injuries, prevention, everything we'll try to cover in upcoming sessions. So if there's anything, you can connect to us through the emails, which we have been using to communicate with you. And so as of now, thanks a lot. Bye. And Vaibhav, thanks a lot again to you. You have spared too much of your time for these 2 days, and I understand looking at your busy schedule. So this must not be very easy for you. So thanks a lot again.
No, it is my pleasure to be here. Yes, a little bit of issues from my side. Apologies for that. For today, starting a little bit delayed because of the internet issue and the Ganpati festival going on here. So a little bit combined in these things. But it was very nice of you to invite me here and allow me to share my whatever knowledge I have with the upcoming physios and other people. It was my pleasure to be here. Thank you so much, Doc.
Thank you.
Thank you so much.
Bye. Bye.